Dr. Collins and your colleagues, fellow doctors, I appreciate the opportunity to have this conversation with you this morning. This is a beginning course for me, 4 months of being a United States Senator and being a member of this subcommittee. But I'm excited about joining Senator Harkin and Senator Shelby and my colleagues here. I think medical research is a huge component of the future of our country. I think it matters greatly, and I commend you for your efforts to date. In my health care reform bill, we would support medical research in a dramatic way. I think it's a cost-saving measure. It's about saving people's lives, improving the quality of their life, and so from an economic, as you point out, but also from a personal humanitarian point of view, what we do here in this subcommittee and what you do at NIH matters greatly. And I would welcome the opportunity to become better acquainted with NIH, its personnel, its mission, maybe the people in the rows behind you. I want my doctors out there doing the research, but I'm happy to have others at NIH devote some time to educating me so that I can better understand how we can advance the cause of medical research here in the United States. I would ask first if there is something missing. We're here on an appropriations subcommittee, but other than money, is there something missing at NIH or here in our country, the United States, that makes it much more difficult or makes it difficult for you to reach the goals that you outlined for us today? Or is this just a financial issue? How many dollars do we devote? What are the other, if any, impediments toward success?
Senator, I appreciate the question and certainly appreciate your strong statement of support, and you're most welcome to come and visit us at NIH. We'd love to host you for a visit and show you some of the things that are going on in the laboratories and in the clinical center, the largest research hospital in the world that's up there in Bethesda.
Thank you.
But as you know, most of the money that NIH sends out in grants goes to the 50 states, including Kansas, and we're very proud of the research that's going on there in your state.
Thank you.
In terms of other things that potentially are barriers, certainly we do not have what I would call a vigorous pipeline of young scientists coming into our field. And part of that is the sad state of K through 12 science education in this country, which is certainly by any measure slipped badly over where it used to be back in the 30 or 40 years ago in the sort of post-Sputnik arena where science education was really emphasized. Now in many schools, it is unfortunately quite rudimentary. And I think we lose, therefore, the chance to capture young people's imagination that science would be a place they wanted to spend their own careers. And that means we have fewer American-born individuals who are clamoring to come into our laboratories and make the next great discoveries. We have lots of interest from individuals born in other countries to do that, but that interest has actually declined a bit as more opportunities are present in their own countries. Some of them, certainly in large numbers, still come to train in our universities, but they often now go back to their their original homes and carry out research instead of staying in the U.S. And some of our visa practices have not helped in that regard in terms of making such talented scientists from other countries feel less welcome than we wish they were. It seems to me that would be a very important area for us to, again, try to get right because it is to our advantage to recruit such individuals, and our universities are still seen as the very best in the world, to come and do their research, but then for us to also be able to capture their talents in an ongoing way, I think would be a great advantage. That is just one of the areas. But frankly, the major concern that I think we have is just the lack of sufficient resources to chase down all of the great ideas that are now potentially possible.
I appreciate that answer and look forward to finding solutions in that regard and understand now the importance you place upon the resources. I did visit the University of Kansas last week and one of the research facilities there, the Molecular Libraries Program. And I'm very interested in what the ranking member pursued in regard to NCATs. And when I heard your testimony today, my assumption is that this will take a lot of different kinds of scientists engaged in this effort. And I guess an initial question would be, what steps would you anticipate being taken to ensure that the best of American science in as many areas will have that opportunity to contribute to this new program?
Well, very appropriate point. It will take an interdisciplinary effort of a considerably revolutionary sort. It means bringing together biologists and chemists, as no doubt you saw at the Molecular Libraries program in Kansas, along with computational experts, structural biologists who can actually figure out the shape of molecules and figure out which shapes fit together in a way that might make a particular drug work, immunologists who can help us with monoclonal antibody development, engineers who can work on devices that will be the next generation of what we need for all manner of medical applications. And those disciplines traditionally haven't had such an easy time talking to each other. And one of our goals through this program and many others is to do that. Maybe this is also partly an answer to your first question about what are some of the barriers. In some way, our own traditional disciplines have presented some of that problem, although I think those barriers are coming down. Clearly, there's a lot of excitement, and I suspect you perceived that in your visit to the Kansas Center, about the potential here of bringing those disciplines together with these new comprehensive sciences to enable academic investigators to play a larger role in re-engineering this broken pipeline to try to make it possible to come up with therapeutics and devices and diagnostics in a shorter time period. This resonates with me for the same kind of feeling I had about the Genome Project 20 years ago. It was controversial then, too, of course. A lot of people wondered whether this was biting off more than the government could chew. But it recruited into the effort some of the best and brightest minds of that generation because they could see the potential. I think that same atmosphere is beginning to appear in translational science, and I suspect once we have the programs in place, it will not be hard to recruit some really brilliant minds to play a role in this. Harold, did you want to add to that?
I think it might be important to reassure you, Mr. Moran, about the effort that's being made in translational research across the institutes. As Francis alluded to in his testimony, a great deal of work, interdisciplinary work indeed, has gone on in the institutes and will continue to go on while NCATS provides a catalytic advantage to the efforts that we're making by providing new methodologies, ways to analyze how translational research is done, some core facilities. But as you probably know from going to your cancer center at the University of Kansas, that there is a lot of translational research going on there, and that's done by interdisciplinary teams. So all of us at the NIH are engaged in this process, and we've had a lot of experience in gathering multidisciplinary teams over the last decade or so to do this kind of work.
So it's not new, and we know it. It can be done. It's being done today.
But we're all engaged in the process, and it's not going to fall solely on the head of NCATS.
And unfortunately, I'm on the social science in my education, and I detect that the same thing may be there between chemistry and biology as there is between history and political science.
Could well be. Yes.
But I appreciate that, and I did see the enthusiasm. That was perhaps the takeaway of my visit, is the excitement that is there. And the belief in the potential of what can be accomplished. Yes. It's very appealing.
Dr. Fauci wants to add something.
There's one other thing that sometimes gets misunderstood. We mentioned, and Dr. Varmus mentioned also, that there's a lot of translational research going on. What the center is going to be directing itself at is to really advance what we call the discipline of translational research. In other words, to help us to do more innovative ways of approaching translational research. So translational research goes on to the tune of many billions of dollars at the NIH, mostly in the big institutes, but some of the smaller institutes also. What we want to do is advance the discipline of how it's done, making it a 21st century approach to translational research, as opposed to relying on many of the methodologies that have been good, but that we think we can do better on. That's what it's really all about, putting forth the discipline and improving the discipline of translational research.
Dr. Collins, perhaps my question is in ways related to the Alzheimer's chart you just showed, which was a request that, do you have information to substantiate my suggestion or a belief that money spent on biomedical research results in cost savings in healthcare? Is there that kind of science-based fact that substantiates my feelings?
So those are complex economic analyses, and even economists will tend to disagree with each other about the right way to do it. Let me just cite a couple of figures, though. If you look, for instance, at heart disease, what's happened in the last 40 years? Dr. Shurin will tell you we've seen a 60% drop in mortality from heart attack during those 40 years. The cost of that, if you average it out per American per year, in terms of the research that led to those advances, beginning with the Framingham study, going through with the development of understanding about cholesterol and ultimately the development of statins, It's about $3.70 per American per year, the cost of a latte, and not even a grande latte. That would be a tall, I think. And if you add up the economic benefits that have resulted from the increase in longevity that have occurred between 1970 and 2000, I am told credible economists believe that adds up to $91 trillion. Michael Milken, in a recent editorial in the Wall Street Journal, runs through a lot of those figures, and they seem to be cited by reasonable experts. If we were to diminish the frequency of cancer by just 1%, and that's actually happening each year. Each time the frequency of cancer goes down by 1%, economists say that's saving our country $500 billion in terms of economy that is sustained as a result of having those people with us. So the return is enormous. I could cite you specific examples of new technologies, but the big picture is quite compelling.
Well, I'm not surprised by that. It would be very helpful to have that, I don't like the word soundbite, but that phrase that says for every dollar spent, here's what we're able to save in otherwise spending on health care. Let me go back to something more specific and just ask you to elaborate upon the value of academic and nonprofit research institutions' role in developing therapies and treatments for rare and neglected diseases through NCATS, as you propose, and through your therapeutic and rare neglected disease program that you already have. Is there a role, is that something that you envision as having a significant role in the future as you develop NCATS? Are these neglected diseases?
Indeed, and in fact, the 27 institutes and centers at NIH have been engaged in such efforts for rare and neglected diseases for some time. We expect that the advent of NCATS serving as a hub of this activity will further encourage that and hopefully contribute innovations that will result in more rapid progress and also a lower failure rate. The TREND program, Therapeutics for Rare and Neglected Diseases, which the Congress authorized 2 years ago, is specifically devoted to identifying projects that might otherwise sit there untouched, where there's a real promise in taking a therapeutic and moving it into the preclinical space, which is often called the valley of death, because that's where often good projects go to die. Take example, sickle cell disease. There's a TREND program right now pursuing an interesting therapeutic for sickle cell disease, originally identified at a university, Virginia Commonwealth University, then licensed out to a biotech company, AESRX. Biotech company carried it to a certain level and then ran out of money, and venture capital is hard to find these days unless you have something that's going to result in profits within a couple of years. So the company has now partnered with the NIH to move this forward. The preclinical studies look very good. This will, as I understand it, be submitted to the FDA for an IND application later this year, and clinical trials may well get underway within a year at our NIH Clinical Center. If this were successful, this would be a radical new approach to sickle cell disease. The way this molecule works is unlike anything that's been tried for this disease before. And while this is certainly a neglected and relatively rare disease, it still affects tens of thousands, hundreds of thousands of individuals in this U.S. and many more across the world. So it's a good example of a way in which NIH may be able to assist in the current scientific environment to move projects forward that otherwise would have languished.
Thank you very much, Mr. Chairman. Thank you, and let me express my gratitude to all of you for your public service.